All right, so the outcomes measure that I'm going to be performing today with my patient is the Barthel index. And this is a self-report measure, but it can also be used as a direct observation. And the population that's usually addressed with this measurement is older adults, and then also people that have had a stroke or traumatic brain injury or any other type of neuromuscular or musculoskeletal condition. And the G code that's addressed with this outcome measure is self-care. So the Barthel index is scored on a scale of 0 to 100 and in increments of 5. So a score of 0 to 20 would be total dependency, 21 to 60 is severe dependency, 61 to 90 is moderate dependency, and then 91 to 99 is slight dependency. And with this, it just kind of looks at what the patient is able to do as far as self-care and daily activities and how much help they need with it. So for my patient, I'm going to be using the self-report and have the patient fill out the survey because he does not have any cognitive impairments and he's able to perform this with just minimal assistance and some guidance from me. So, all right, this is my patient, Rob. All right, so I'm going to be guiding you along with this survey and kind of give you some hints for how to score. And then I'd like you to score, and it needs to be what you can do now. It can't be what you think you can do in the future or what you did in the past. It needs to be what you can do on yourself now.
Okay.
By yourself now. Okay. So for the first section is feeding. So you can score a 10 if you're completely independent with feeding yourself. If you're able to feed yourself a meal from a tray. And if you're able to cut up your food, use salt and pepper, put butter on your toast, and be able to do this in a reasonable time, then you can give yourself a 10. But if you need some help, such as cutting up your food, you get a 5. And then if you're not able to do anything, you get a 0.
Okay. I think I'm about a 10 on that one.
All right. So the next part is moving from wheelchair to bed and then returning back to the wheelchair from the bed. So to score a 15, you need to be able to do this independently and do all parts of it independently. So you need to be able to make the wheelchair go and approach the bed, be able to put the brakes on, move the footrest out of the way, be able to safely get yourself into the bed from the wheelchair, and then be able to lie down, and then also then be able to sit up and get yourself back into the wheelchair and be able to propel yourself away from the bed. And you need to be able to do this independently and safely. So if you can do that, it's a 15. If you need just minimal help with just a couple parts, or if you're able to sit up in bed, and do most of it, but you just need a little bit of supervision for safety, then you get a 10. And then you would score a 5 if you're able to sit up in bed or sit in your wheelchair, but then you need help for the transfer from getting from one place to the next. Then you score a 5. And if you're max and need, complete help, can't do anything, then it'd be a 0.
Well, I'm a 15 for that one.
All right. All right, so the next one is comprises just some activities of daily living, and if you're able to do everyday things such as washing your hands and face, combing your hair, brushing your teeth, if you're able to shave using any type of razor, and then you should be able to put in a blade or plug in the razor without any help. And also be able to get everything from the drawers or cabinets where it is. So if you can do that by yourself, then you can get a 10. But then if you need any type of help, you get a 0.
I can do all that as
okay,
well.
Good. All right, so the next part is getting on and off the toilet. So to score a 10, you need to be able to get on and off the toilet, be able to fasten and unfasten your clothes, be able to not get any of your excretion on the clothes, and use toilet paper without help, and
I'm sorry, I just think it's kind of funny.
Oh, I know.
Yeah.
I'm sorry. I didn't use a good term.
It's just a little embarrassing.
Okay.
That's all.
Yeah, no, it's fine. So, not get any of your clothes messy or dirty. And then be able also to use toilet paper without help. And for this activity, you should be able to, it's okay if you use a wall bar or a handlebar, any stable object to help you get on and off the toilet, but you need to be able to do it independently.
Okay, I can.
And then if
also
you can't do
those.
that and you need some help, then it's going to be a 0
Okay.
for the score. All right. And the next part is bathing yourself. So you would score number 5 if you are able to use either a bathtub, a shower, or a complete sponge bath. But you should be able to do all of it without anybody being present. So you feel safe and competent in bathing yourself.
Okay. Yep. Feel good about that one.
Okay. All right, so then the next part is going to be walking on a level surface. And for this, there's kind of 2 parts. So for you, you're able to walk. So we'll do the first part. But if you were not able to walk and you used a wheelchair, then I would explain to you the 6A part, which is propelling in a wheelchair and your ability to do that.
Okay.
So for the walking part, you would score 15 if you're able to walk at least 50 yards without help or supervision. It's fine if you have braces or prostheses, or if you use a crutch or a cane, any type of thing like that, any assistive device or brace, orthotic, that's fine. But you cannot use a rolling walker to score 15. And you need to be able to lock and unlock your braces if those are used, and be able to be standing without any help and just have complete, ability to do that independently. And if you're able to do that, then you get a 15. And it's 50 yards because for instance, if you were at home, if your house caught on fire, you need to be able to walk at least 50 yards to get from your house outside safely. And so that's a huge factor of, being able to discharge patients and whether or not we feel comfortable letting them go home or not, depending on their walking distance. So that's a big factor.
Cool.
So make sure you score honestly for that. And then you can also get a 10 then, and that would just be that you need some help or supervision. So if you really feel like you couldn't do this alone, then that would be a 10.
Okay.
And then a 0 if it's below that and you need a lot of help.
Cool.
All right. And then for the wheelchair, I'll just explain that briefly, even though that doesn't apply to Rob. It is if the patient cannot ambulate, but they use a wheelchair, and if they're able to go around corners, turn around, maneuver a chair to a table, a bed, the toilet, and then also for this, he must be able to push a chair at least 50 yards for the same reason. So that would be if he was in a wheelchair not able to walk. The 7th part is ascending and descending stairs. So you would score a 10 on this section if you're able to go up and down a flight of stairs safely without help or supervision. And it's fine if you use handrails, a cane, or crutch, but you need to be able to carry those canes and crutches as you ascend and descend. Okay. And then if you're not comfortable and feel like you can't quite do that, then you could score yourself at a 5, which is just some help and supervision with any of those items. And then a 0 if you feel like you really need a lot of help or not able to do it at all by yourself. The next part is dressing and undressing. So if you're able to put on, remove, fasten, unfasten all of your clothing articles, if you're able to tie your shoelaces, but you can also score 10 in this section even if you have to use adaptive devices for this. And then also with this, it's important that you're able to put on any type of braces or corsets that you have. And then any type of special clothing such as loafer shoes, dresses that open, suspenders, any type of extra things. If you need to be able to also do that is to score a 10. But if you need some help with that, you would be scoring a 5. And then if you can't do any of it, it would be a 0.
Okay. Gotcha.
And then our next section is about continence of your bowels. So that's to score a 10 for this section, you need to be able to not have any accidents, be able to control your bowels and not have any accidents. You need to be able to, if necessary, use a suppository or take an enema. And that's like for instances such as a spinal cord injury and those who have had bowel training. You would score a 5 if you need help in using a suppository or taking an enema, or if you have occasional accidents.
Okay.
And then it would be 0 if you're completely dependent.
Okay. 10.
All right. Awesome. Okay. And then the last section is about whether or not you can control your bladder. So for this section, you can score a 10 if you're able to control your bladder all day and all night. And for people that have had a spinal cord injury, if they're able to wear an external device and leg bag, they must be able to put them on independently, clean and empty the bag, and stay dry day and night, which that obviously doesn't apply to you, but I'll just explain it. And then if you feel like you can't do that independently, then you would score yourself at a 5 if you have occasional accidents or cannot wait for the bedpan or can't wait for the toilet, and if you need help with any type of external device, if that was necessary. And then if you were completely dependent, it would be scored as a 0.
Okay. Well, I've been a 10 since age of 4, so
Good.
I'll put that down.
Good. All right. So for this test, then, I would look at your total score of what you scored as. So in your case, you scored a 100, which just means you're independent with all of your activities of daily living and your self-care. But if you were not independent, then that is when we would just that would help us predict how long you need to stay in whatever setting you're in, and then that would predict where you would go next and how much assistance you would need throughout your rehab.
Okay.
All right, so good job today.
Thank you very much, Doctor.
Thanks for being honest. Yes, good
Yes,
job.
of course.
Thanks.